She is a brand of Vyasa Healthcare Private Limited and integrates Ayurveda, yoga, and naturopathy for better treatment outcomes. She's also an entrepreneur in the field of integrative medicine, an Ayurveda and yoga therapy consultant, researcher, and international speaker with 20 years of clinical experience. She has completed a bachelor's degree in Ayurveda from the government's Ayurveda Medical College, Bangalore in the year 1999, master's and PhD in yoga from S. Vyasa University. Her doctoral work is on integrating Ayurveda and yoga therapy in the management of migraine headache without aura. She has published 4 papers based on her research on migraine. She has been a clinical practitioner from last 21 years and a practitioner of integrative medicine since 15 years, combining the traditional Indian system of medicine, Ayurveda, yoga, and naturotherapy. Her area of specialization includes integrative pain management with a focus on migraine, headache, and women's health problems, including infertility. She has 4 publications in the field of migraine headaches. She's also an adjunct faculty division of Yoga and Life Sciences at Vyasa University, Bangalore, and a reviewer of the Journal of Ayurveda and Integrative Medicine. She has been a speaker at several international conferences, and the recent achievement was her presentation on the intervention of yoga and Ayurveda in the management of migraine headache at the American Headache Society's annual Congress in 2019. For today's topic, autism spectrum disorder is characterized by impairment in social interaction, behavior, speech, and language in children. Children present with digestive complaints, sleep deficiency, and sensory impairment, attention deficiency, and so on. ASD can be detected in infancy or early childhood. Early intervention with therapies combined with Ayurveda and yoga play a crucial role in balancing the autonomic nervous system and improving gut health. Improvement has been observed in children between 2 to 7 years of age after 2 to 3 months of intervention. So without further ado, Dr. Vasudha Sharma, please take it forward.
Yeah, thank you very much, Ms. Surabhi. So I'm glad to be here to be presenting whatever I have learned and understood in my journey of especially autism. So let me also begin by sharing my presentation, and that's where we would start with. So yes, let's understand more about yoga and Ayurveda for autism spectrum disorder today. So I'll be sharing across these particular formats. Let's understand, in brief about what autism is all about, because the reason I bring in this in the presentation is because, during this whole journey of understanding, we see that many people, especially parents who need to understand more, yoga therapists who need to understand more, or many other doctors, supportive therapists who need to know, also need a consolidated format of autism as such, autism as it is called as autism spectrum disorder, or ASD, as it is commonly known as. So it's a complex, behavioral disorder. And what we see is it has got, constellation of problems or constellation of signs and symptoms, which we see. When I say constellation, that means to say you see a lot of things happening in a child who probably is autistic, but we haven't still diagnosed that the child is autistic. So we see social communication deficits, lot of sensory and motor related behaviors, lot of changes which may be repetitive in nature also. And what we have to understand here is diagnosing these things in the right time, in the right time frame, is extremely crucial. And the diagnosis therefore goes by the DSM-5, which this is how, medically it is designated based on the Diagnostic and Statistical Manual of Mental Disorders published in 2013, which is the DSM-5. So they keep revising this, and it is based on this that ASD now, though a single problem, has got two main domains in which it is treated or understood as. One, of course, related to social communication, and the other related to restricted, repetitive, and unusual sensory or motor behaviors. So many a times, autism spectrum disorder is also accompanied by different other disorders, but we are not able to understand, that there is an overlap of two different problems. Sometimes there's a lot of confusion. Even parents say, okay, no, my son is, having, or my daughter is having an attention deficit problem, but I'm really not sure. So they themselves come up with such confusions. Therefore, rightly understood, it can overlap with certain genetic disorders or problems such as ADHD, otherwise known as attention deficit hyperactive disorder. Now, let's begin by understanding how the brain in an autistic child looks. What is that we need to interestingly understand when it comes to the neuronal activity. See, anatomically, the brain of an autistic child is very normal, like you or like me. But when it comes to the physiological aspects or the functional aspects, that is where the change is. It is not very normal as a young child's brain is. What happens? The neurons or the nerve cells or the brain cells do not really communicate normally here. And what happens, at that level? The Purkinje fibers, which are actually designated to carry these signals to a part of the brain called cerebellum, is not doing its job very well. And we also see that there are decreased numbers of Purkinje cells. This is also based on research which is available and which is published in a journal which is called Cell Reproduction. And it's very clearly understood here that 50 to 90% cases have shown decreased levels of Purkinje fibers. So what happens? That means to say, when there's decreased level of the cells, the transmission, so it has to move from here to here to here to here. That's how the nerve cell transmission happens, and that's how we can get the signals. Now I'm talking to all of you. I'm receiving, I'm seeing, I'm receiving, it's getting processed, and I'm talking. So this process is not the same when it comes to an ASD child. This is the basic understanding of autism. And when you look at this picture, it is very clear. So what I'm showing here is simple look of a Purkinje fiber unit, and what you see here is how a neuron would look. So for better understanding, I also would like you to understand this particular activity.
Planning a party, switching tasks at a moment's notice, suppressing a laugh when one isn't appropriate. These all require the maestro of brain regions, the prefrontal cortex. The prefrontal cortex sits just behind the forehead. It orchestrates complex thought processes much like a maestro conducts a symphony. In the brains of autistic people, though, it doesn't communicate well with other parts of the brain, and it may have an unusual structure. That may be why autistic people often have trouble with making plans, thinking flexibly, or controlling their impulses. Drugs or talk therapy may help to improve the function of this brain area and even, eventually, ease some autism traits.
Yeah, so what we have to understand here is what exactly happens, in a autistic brain, as we were just seeing.
Planning a party, switching tasks at a moment's notice.
So here, therefore, we need to now know what could be the cause behind this happening in the brain. They are broadly classified into genetic causes or environmental factors. So when we say genetic causes, then the word says it all. It is inherited. So it can come inherited, in the familial gene. And you also have various other environmental factors. So when you talk about environmental factors, what exactly are these? When you can talk about this, you can talk about immune system disruption. And you can also understand this a little more at a pre-genetic level. Many a times there is a question, why should be the pregnant lady, taken care of? Why should the pregnant lady understand that her health should be good? These are some of the reasons why you should know that a problem like ASD can be well prevented at that time itself. That is the perinatal phase or the prenatal phase, which plays a very, very crucial role. And that point of time, maintaining the perinatal environment is very crucial, because a pregnant lady can get vulnerable to a viral infection, can get vulnerable to maternal diabetes, can get problems due to stress, which is very commonly known, the prenatal stress. So what we need to understand is better avoid stress at the level of pregnancy itself, because this can really, really alter a lot of things for you. Now, why are we trying to talk about or understand about causes? Because we know that it is extremely crucial, especially nowadays with the mechanical lifestyle which we have, or post COVID, we have also learned sitting at home. Majority in the world have done that. Right now, most of us are going back to work. All said and done, the perinatal phase is extremely important, and I'm stressing here because that's in our hands. Genetic factor is not greatly modifiable, but yes, still modifiable, and we will try to understand how and where things can play a role, so that the genetic predisposition can be reduced, though may not be certainly taken off completely. So when we talk about pregnancy, fetal programming is a very, very interesting phenomena. And the term phrase says it all: fetal programming. Program your fetus the right way, follow right diet, lifestyle, and reduce stress for yourself, so that the newborn is healthy and the newborn is not going to experience a problem like ASD. So today we are focusing on ASD, but we should understand that there are many more problems which can be prevented if we are a little more careful and little more conscious that yes, the lady should understand, I am pregnant, let me do the best, because I am going to give birth to a healthy child. So as we go ahead, once we know what happens in the brain, in a very superficial way, like I explained, based on the neuronal activity, then we say why this is probably happening. Now, when it comes to the actual, people start seeing some signs, in a child. There is failure or lack of normal back and forth conversation. If I give you an example, it means to say the the parent is saying, hey, hello, no, the child is not looking at the parent at all. Hey, come on, why don't you get me my spectacle? No, the child is just playing, he's just to himself. He's not even giving a ear to what is happening around him. And is he able to say something? What's your name? No, the child is just looking blank. So is he looking at you? No, he's not even looking at you. So he's not giving you an eye contact. So these are some very, very initial observations which anybody should make. Whether you're a parent, you may be now here, there's a forum of yoga therapists I'm addressing to. So you are, the people who can also understand these concepts and help people more to understand that better. Next, you have, emotions not being shown up. Whether sometimes, children also fall down, they start crying, they're able to make out that they're hurt. Unfortunately, some of the children, based on the grade and severity of autism, may not be able to understand this. So crying is an emotion. Okay, laughing is an emotion. Sometimes they may be overdoing laughing. So they're all the time laughing. You ask them, they're laughing. You are sad, still they're laughing, because the child has nothing to be blamed with. The child does not understand or is not able to process these at all. So therefore, reduced sharing of interests or emotions. This is another, sign you would see when it comes to social communication. Failure to initiate or respond to social interactions. Somebody is saying, hey, just come home. Hey, what's your name, child? No, the child is just either, holding on, latching on to the mother or to the father, and the child is unaware of the question. Sometimes some children are much better if they're mildly autistic, but still they might have, verbal or non-verbal communications which may be affected. Lack of facial expression is also, a part of the emotional response, and difficulty in sharing imaginative play. So here, to give an example, now usually what happens, a 3-year-old child or a 5-year-old child or even a 7-year-old child is usually playing with a group of children, right? So when, say, let's take an example, people are all living in apartments. So there, we have a chance to get a group of children, even if it is COVID, somehow when things open up, children can go back. So this child doesn't want to go and mingle, with the peers, with its counterparts. So these are some of the things which very clearly tell us that is a gap, for social communication or social interaction. Therefore, the child definitely has a lot of problem in making friends, and saying that, yes, I want to go to play. So you may not hear this very frequently from the child, or you may not hear it at all. So the parents many times prompt, the parents might many times play, and the child is otherwise engrossed in the basic activities. He is just liking playing with the pen. He's all the time playing with the pen. Otherwise he's liking to see some object or something else at home, so he's fond of it. So he's always in that in his own world. So many times we see parents using this term itself. So understanding further the repetitive behavior, which is very common in a child with ASD, can present differently. So many times we see a stereotyped repetitive behavior. That means to say, if the child likes, kind of moving around himself, then he keeps doing that very often. So otherwise, he also has, other behavioral symptoms, which is called as stimming. Many times this word is used. So it could be stimming, could be, either moving his head back and forth, moving his arms, flapping his arms, and such many other such actions, which can be some, movement of his fingers. So these are all repetitive movements, mostly motor. And you also have additional verbal behaviors also which can happen. It could be humming. Many of them make sound, this kind of sound they're always making. If you go close to them, you can hear them. And many a times we hear parents saying that my son or daughter is usually making that humming sound, but he's not talking. So these are some things which we see in the repetitive behavioral issues. Also, inflexible adherence to routine. So the child, it is very difficult for us to train the child to say, okay, now you have to wake up, then you attend to your natural urges. That means you go and attend to your potty. And then next you have to take a bath, you have to brush your teeth before that. So all these things may not be very systematic in the child. So we will have to force and get them onto that. Still, many of them face difficulties in just getting the child to brush the teeth. So many of such, adherence to routines may not happen. Then they have a lot of fixated interests in terms of, as I was just explaining it, in terms of play, in terms of behavior, in terms of eating. So a lot of these aspects come in when we talk about fixated interests, otherwise associated with hyper or hyporeactivity to sensory inputs. So when we say hyper, so you're talking, or you're kind of loudly talking, the child doesn't like, so he might just close his ears. This is his response to a stimulus which he's able to perceive, but he's unable to process the stimulus. You probably expose them to some bright light, or bright color, they still may not like it. And there may be a hyper responsiveness or a decreased responsiveness, which is hyper-responsiveness in the child. So this is how you can see the repetitive restricted behavior in a child with autism spectrum disorder. And having understood this, now we'll have to say, what are the things, or what are the signs we need to observe in a child so that we are tapping the problem right at the beginning and not waiting till the child is 5-year-old or 6-year-old. And why are we, why should we be very careful with this? One important point here is most of the children start talking between 2 to 3 years of age, right? Many of them, by 3, they're talking very well. Some of them start only at 1.1, 1.2. Till their first birthdays, they may not have spoken at all. They would have just said, Mama, Papa, that too in their own words, their own way of babbling. Slowly towards 2, there is some things, which are being audible. So many a times, parents get confused. They might feel that, okay, my son or daughter has probably started to talk late. And one other problem which I have seen, based on my experiences, they say, see, my husband's side, if the wife is talking, we have a history that, all, including my husband, started speaking only when they were 3.54. So, all of us felt that probably my son or my daughter would also be talking at the same age. So we were just waiting to see if the child starts talking. But we should understand that this early sign is just not about speech, just not about talking, but it's about different, other aspects too. Therefore, to avoid, or see that the diagnosis is made as early as possible, we should recognize few things. These are the early signs. What are they? Inconsistent response, which is recognition of name. Hello, Aryan. No response. Why? He's 2.5. Why should there not be a response? It has to be there. So we have to kind of start understanding these things in a very sensitive manner, not bringing our ego here. Now, it's when you talk about a wife and a husband, the observation generally is, don't blame each other. Finally, it's not for you, it's not for me, it's for the child, right? So that is the thought we have to bring in. Difficulty with language, babbling, but there's no progress or no babbling at all. So which has to happen even if the child is usually around 2. Therefore, usually the diagnosis of autism happens between 2.5 to 3 years on an average. Now, the next early sign is throwing tantrums, anger. Do you see anger in a normal child of who is about 2.5, 3 years old? Usually not, because the child's behavioral pattern is set like that with a normal milestone. Then there are also obsessive interests. We just spoke about repetitive activity like stimming, humming, and few more. Eye contact. There is difficulty in establishing an eye contact. The child is usually looking somewhere, not interested, putting his head down. These are some early warnings. And difficulty to bond. Many a times it so happens that the child doesn't even recognize the parent. Definitely, it's such an emotional hit to the parent, you can understand. But still, this is one of the signs which the parent should understand and accept, because acceptance is the first thing which can really help your child. So please keep that in mind as well. And, irregular sleep. So delayed early waking up, it's very difficult, for the child to go to bed or wake him up, vice versa. And many a times, or most of the time, we see a lot of gastrointestinal symptoms such as constipation, bloating, abdominal pain, and here and there, people also complain of diarrhea. So these are some of the early signs which we have to start understanding. So when it comes to, say, now, the audience, say we're talking about today's audience, we have, say, yoga therapists, we have even some of the parents, some of the people who are interested to know more, and all of them joining us. So overall, this is, one level of interaction we are trying to have to say what causes, what could happen, how do we pick up, right? So in the same way, let's also now understand what could be the levels of autism. So usually 3 functional levels where we talk about ASD level 1, level 2, level 3, with level 1 requiring support, where they find it difficult to initiate the social interaction. Level 2 needs substantial support, from anybody, when we talk mainly from parents and all the others who are definitely involved in helping the child achieve his milestones. And ASD level 3 requires a little larger support. And therefore, as and when they experience different problems, it could be verbal, non-verbal issues. So therefore, having understood and having, probably felt, okay, maybe does this child have a problem? What should we do? What is the next step we are supposed to take? The next step we are supposed to take is go to a pediatrician, because the pediatrician is the nearest doctor available wherever you are across the world, right? So in at least major cities and towns, you definitely have good pediatricians. And what do you ask them for? So you're basically gone there not to say my son may be autistic, or you would just have to say, okay, some of the signs I'm seeing in my child is 1, 2, 3, 4. So the pediatrician will be able to guide you and say, yes, okay, probably we need to do an assessment or a screening. And what all do you do? So this is, the information which I would like to share. And we just to know, okay, what are the aspects which are undertaken? MCHAT is one of the popular tests which is done. It is a 20 question test usually, and it is designed for toddlers between 16 to 30 months. And that's otherwise expanded as modified checklist for autism in toddlers. And it's a revised questionnaire. And other questionnaire, as per the Center for Disease Control, is the Ages and Stages questionnaire. And it's a general developmental screening tool, and it examines developmental challenges at specific ages. And the third one is called STAT, screening tool for autism in toddlers and young children. And it's an interactive screening tool. It's just not like a questionnaire. And it usually has about 12 activities that assesses the play, communication, and imitation in a child. The last one, the fourth one, which CDC recommends, is parents' evaluation of developmental status. And it's a general developmental parent interview, which is designed to identify delays in language, speech, motor skills, and much more. So you see that 3 questionnaires are specifically evaluating the child, but the fourth one is evaluating the parent. So it's so crucial, for the parents to be involved in the growth and development of the child, and parent is the key, and I've seen that in most of the cases whom I'm trying to help with. So when now the pediatrician has, done the screening, has assessed. If not the pediatrician, you can go to a developmental pediatrician. You can also go to a speech pathologist, and they can at least guide you to say, okay, this is where you can go. If you don't understand where to go and you're still seeing some signs in your child, don't worry. Just, go to any GP or a general practitioner near, your home. So they will be definitely able to guide you. But first of all, what you should know is get out of all your reservations. Never keep the reservations, never keep your ego saying, my child will talk, my child will do this, maybe, his age is too less. First of all, I, request and kind of would like to communicate to those who are watching that, yes, please understand and please go and seek help. And seeking help is not at all considered wrong. It's not about seeking help alone. It is to seek, the overall growth and development of a child to make its future better. Once we understand what's the next step we have to take, bring in the right intervention. So when we talk about right intervention, what are the different interventional modalities available today? Lot of modalities, but yes, we should know that we can bring them and put them into 4 categories: behavioral and communication approaches, dietary approaches, medication, complementary, and alternative medicine. So we are here today to understand more about the complementary and alternative medicine. I actually would not call it alternative medicine. It's about whatever you're using mainstream is your mainstream medicine. Let's first understand about behavior and communication approaches. So ABA, very commonly known everyone knows the terminology ABA, applied behavioral analysis. There's so much of screening which goes into it. The therapist has to really spend quality time. First of all, the therapist should understand, how do I really give an ABA which is not monotonous, but which is changing, in accordance to the child's requirement. And that's very crucial, be it ABA or be it OT. This is occupational therapy, because we many times observe that after a while, the parents are also, kind of not happy with therapists because the same things, keep repeating. And you should also understand one thing here is the child is also very intelligent. This autistic child or an ASD child doesn't lack intelligence. They're usually extremely intelligent children. And we just have to tap their energies and modulate the right way. And that is where we are going to achieve our target of improving their overall functionality of the brain. So here, somebody was over a conversation, with a parent, we were discussing that the child has 3 blocks. Whenever you go to an OT therapist or occupational therapist, so she says, okay, this is orange, this is red, this is blue. And she shows him in the same order, orange, red, blue. Now, whenever she shows the first one, the child says orange, second one, red, third one, blue. Now, she's doing this for the whole week. Now the parent is, kind of changing this order. Child may not be able to recognize. So we have to break certain monotonous approaches, which we may adapt in especially helping children. But said and done, therapists are doing a wonderful job, because if not for their dedication, their time, and their interest, and the first most important point is passion to help these children, the whole circle is not complete. Next, you have social skills training, and of course, speech therapy, which is a very crucial aspect. Speech therapists, speech pathologists, all of them play a very crucial role, because how do you get the syllables out of the child? Now the child is silent. Okay, whenever he wants, he can scream. Whenever he wants, he can cry. But why is he not saying A, B, C or E or mama, papa? Why is he not saying? One, because his speech center functioning or the neuronal activity which we spoke about is not adequate. The signal says, okay, now come on, talk, but doesn't get processed. So he obviously is seeing something, but he's not able to process it the right way. Therefore, he will not be able to utter the word or the syllable. And who can really get that out of his mouth repetitively, saying, when you keep doing that, open your mouth, put your tongue up, do this, move your, roll your tongue, put your cheeks into action. All this can only get speech out of your mouth, right? So this is where speech therapist plays an extremely crucial role, because majority of the autistic children have speech deficits. Next aspect we're talking about is medication. So when we say medication, of course, the FDA talks about different drugs, and it's said to be the body for food and drug control. So antipsychotic drugs such as risperidone are very commonly used in treating children with ASD. But research also shows and says that medication is most effective when used in combination with behavioral therapies. Also, please note, medication can be or is associated with risks. When you ask me my personal opinion, I definitely do not recommend medicines such as antipsychotic drugs, because they have a very different impact. You have to venture into it only when the child has some destructive behavior, and you might do it only on an SOS basis, and of course in consultation with your doctor only. So overall, when we want to understand more and more of it, we can definitely have discussions. But today, we are now shifting our attention towards the next aspect, which is diet. So why are we throwing so much of importance on diet? Because the gastrointestinal concerns in an autistic child are many, such as diarrhea, constipation, abdominal pain, not eating well, or eating anything which he might find, which is called mouthing. So these are some of the problems, and this can also improve quality of life. That means to say, right diet can improve the quality of life. What's the very, very common dietary modification? GFCF. What are you following? I'm following a GFCF diet, gluten-free, casein-free diet. But let's now understand what is research talking about. There are many studies on GFCF diet and they're mixed reviews. Let me first talk about the positives of it. So ASD children are definitely highly benefited by the gluten-free diet. Why? Because they have inadequacy in them to digest gluten, and if it is consumed, it can increase the exorphins in the body, and it also, therefore, when not consumed, reduces the non-specific GI symptoms. And this particular study is published in the journal Nutrients, very recent, 2021. But we cannot take these, the findings, and we cannot say that it is applicable to all. So it's like now COVID vaccination is applicable to all? Yes, 100%. But still, is it applicable to children? It is not right now, unless research is able to say that, okay, it's extremely safe for children. None of us want our children to get vaccinated. Similarly, when you talk about GFCF diet, please note that it's not 100% needed for every other child with ASD, because certain studies like the one published in the Journal for Autism and Developmental Disorder in 2016 is clearly telling us this. Let me just brief you about the study. It's a double-blind study with 14 children between 3 to 5 years of age, and it is telling us that it does not provide evidence to support general use of GFCF diet, because in a double-blind study, there's one group given GFCF, another group was not given anything on normal diet, and both were blinded. Both didn't know what is being given to each other. Finally, they therefore found that there was no significant change in the group which were exclusively on the diet protocol. But yes, we should adapt these things based on an understanding. Let us not be once again blind in adapting the same for all. So, I mean, what I'm trying to say is only this, that we have to pick and choose the requirement of the child, based on the problem of the child, and then administer, because some of them are able to tolerate the GFCF food, or I mean, when you say gluten based food, some of them are able to tolerate casein free. And here, when it comes to Ayurvedic concepts, we talk about the concept of Agni, which is the most important factor for good digestion. And when we keep the Agni in balance, most of our sensory, motor functions are also quite normal. So the other aspect here is Ayurveda also emphasizes on using certain food products such as buttermilk. Definitely doesn't advocate the use of milk, curd, and such other kapha vardhaka ahara, as they're called, those which increase kapha, because they can also bring in a lot of this tamasic quality in the children, making them much more inactive anytime, making them feel heavy. Therefore, their digestion or their gut is already very weak. They can become vulnerable to problems. So therefore, when it's this case, we have to always check on the requirement of the child and give the child the food which is needed. Many times they become calcium deficient also because they are not taking milk or milk-based food. But yes, procurement of the product is extremely crucial here. So, let's also understand that, therefore, that diet is something which definitely has to come in and understood from experts. So please do take help from people who have understood it rightly and make your own modifications. And you have to do it because and child with ASD is many times very selective. Some of the mothers, also say that if I give the child something made in the morning, he doesn't eat it in the night, right? And many of them face this problem. So you have to modify. Many times they might throw tantrums. To stop them from throwing tantrums, please do not give them a biscuit. Please do not give them a cake. Please do not give them processed food, Tetra Pak juices, because these are all very, very important understandings. And if you do not give them, you should know why you should not give them, because it will not interfere with any of the problems in the gut, and therefore not exacerbate his signs, as the child always shows increase in his behavioral patterns when there is a problem in the gut. A direct reference is many children are constipated, and when the constipation increases or is prevalent, then you see a change in the behavioral pattern. Why is this? Because the gut and the brain are very well connected. That's also called the gut-brain axis. And this particular theory has evolved fairly well or adapted fairly well in modern medicine very recently, but ancient systems like yoga and Ayurveda have always been talking about gut health, the gut balance, the Agni, all of them are the same concepts. Next, when we're talking about diet is an integral part of streams of traditional healing methods such as yoga, Ayurveda, naturopathy. You have Chinese medicine, traditional Chinese medicine, traditional Korean medicine. So many of them traditionally present in every other country. And I think Asian countries are quite rich in their heritage as well. But when we focus on certain mind-body therapies, we see music therapy, exercise therapy, neurofeedback therapy, animal-assisted therapy. Very interesting here, right? So animals or pets are said to be very dear. The emotional responses can be better when certain therapies can also have animals along. Because some children have a lot of liking for animals. Then you have hydrotherapy and acupuncture. So this particular journal has really given some elaborate information, and it's good to understand these different methods as well. So what we're trying to know is we need not restrict ourselves, to one particular concept which we understand. Now, I might understand more on Ayurveda and yoga, but I can never decline the other methodology because it is my problem. If I'm ignorant, I would decline. If I'm open, I would say, why don't we explore? Why don't we work together and understand? And overall, when it comes to the treatment modalities, it is very crucial for us to have this approach, of working and integrating different other methodologies together, and that can really aid a lot of improvement in the child. Now, let's get specific focus on Ayurveda. What Ayurveda talks about ASD. Ayurveda doesn't give us a direct reference to diagnosis such as autism spectrum disorder, but it is brought under the classification of Vata Roga and closer to understanding of a particular disease, which is called as Unmada. Unmada, Mada is being, in your state of mind. So you're out of your state of mind. That's how it is coined, but it has got a larger perspective. So don't try to, kind of interpret this immediately by hearing the word and the meaning of the word which I just gave you. So it is said, how does it explain the manifestation? Agantuja bhava, that they are the epigenetic factors, and sahaja bhava, which are the genetic factors. So both of them, when combined, bring in derangements in the channels and which nurture the mind. And because of the derangement, you can you probably understand that there is a problem like autism which has set in. So what else could have happened? It's a genetic factor. There is deprivation of diet, which is mostly the maternal diet, digestive disturbances, and cognitive problems. So this is what we also observe, and is what Ayurveda also talks about when it comes to the understanding of autism spectrum. So very brief understanding of how Ayurveda explains, but let's now understand in with minimum details how Ayurveda talks about treatment. So when we say therapy, the first thing which strikes any Ayurveda doctor would be Medhya Rasayana. So what is this terminology talking about? Medhya is that which improves or nourishes your brain, and these are otherwise coined in modern medicine as nootropic. So nootropics are the class of herbs, the class of drugs which can have an influence on your brain, which evolve your brain functions. That's what it, the meaning of it talks about. Ayurveda gives 4 herbs which are nootropics. Brahmi, botanically known as Bacopa moneri, Mandukaparni, Centella asiatica. You can see a picture of Mandukaparni here. Shankhapushpi and Guduchi, which is commonly known as Ctenospora. So, of course, these are 4 of the herbs which Ayurveda specifies, but there are many more procedures, which are falling in the category of Panchakarma or Purva Karma. And when it comes to different other therapies, therapies such as Nasya, which is installation of nasal drops, which is basically medicated nasal drops, and this can really enhance your brain functions. What it can do ideally is, because the nose is innervated with a lot of nerves, the medicine is also inherently absorbed. So that's how it also helps. And the procedures such as Shirodhara, very also common with adults. When you say Ayurveda, people usually, first thing which strikes to them is Shirodhara. So it's a very simple therapy where we pour warm medicated oil on the forehead, and it is streamed in regular patterns as the picture elicits here. And similarly, therapies such as Abhyanga, which is oil application across the body, and Matra Bastri is another therapy, which is like an enema or a rectal route of administering medication in the quantity the child can take. So all this have to go in consensus with an expert Ayurveda doctor, and you should understand the basis behind how the therapies are designed. So if we take an example of Abhyanga, this is the most common modality which I also suggest in my prescriptions, which parents are asked to do at home. We give them a medicated oil, we ask them to apply it across the child's body, if possible every day, otherwise at least twice or thrice in a week. What this would do, it relaxes the child. When you're relaxed, obviously you're not hyperactive, you're slightly calm, your processing is much more better, and therefore you start feeling, okay, today maybe my son is a little calm, he's able to listen to me, his eye contact is better. So you can start relating it like this. Now, just to give you an understanding of how these nootropics work. So let's also know that we are not just talking about theory alone. We know that there is enough evidence, scientific evidence, which is supporting what we are saying. And this is one bit of it. Ayurveda theory is very large. It's so ancient and it is extremely scientific. So when we talk about neurotransmitters, let's take 3 of them: GABA, serotonin, and melatonin. So these are some of them which are essentially there. They're called neurotransmitters. And GABA as a neurotransmitter is dysregulated in autistic children. Serotonin, you also see abnormal levels of serotonin and lower levels of melatonin in many children. So what happens now? GABA, function of GABA is basically to reduce stress, increase feeling of calmness, and it can also regulate mood. So what happens when it is dysregulated? So either you're too stressed, less stressed, you're not calm, your moods will swing. Sometimes you're good, sometimes you're not. So serotonin, it can regulate your sleep, mainly your digestion. It's called a happy hormone. In autistic children, many times there is increase in serotonin also, which is seen. Therefore, if we now correlate and say the child is always laughing, he's in that hyper mode, all the time. Why? Because of this. And melatonin is something which regulates your circadian rhythm. If there is inadequate melatonin, then your sleep gets disturbed. Therefore, we see that sleep is disrupted in ASD children. Now, what can you do with Ayurveda? Why are we talking about neurotransmitters and those which are enhancing your brain capacities? Because nootropics are cognitive enhancers. Let me bring in a very interesting study, and this has been published in a journal called Rapid Communication in Mass Spectrometry in 2016. Now, Brahmi, very, very popular name, not necessarily with parents of ASD kids, but otherwise very popular with people who have interest in Ayurveda. So they have studied Brahmi in the form of vati, that means in the form of a pill, Brahmi Grita, Brahmi in the form of a ghee-based medicine, and another ghee-based medicine, which is called Saraswata Ghritam. So these were added into differentiated IMR32 cells. This is a cell culture technique, and they were grown for 22 hours. What was done after this? An ultra fast liquid chromatography was done. And what was seen? They saw that the neurotransmitters were eluded within 7 minutes when Brahmi, Brahmi Vati, Brahmi Grita, Saraswata Gritam were already there on the cells. So this very clearly shows that the herbal drugs increased neurotransmitter levels, and out of all of them, Brahmi Vati increased the neurotransmitter level to the largest extent. Therefore, when we prescribe Ayurveda medicines to children, the abnormal behavioral symptoms probably are alleviated. So we also now understand how they can be controlled and how the neurotransmitter homeostasis, which is attained through administration of these herbs, is what is creating a change in children. So it's extremely crucial for you to understand the background behind which all these are administered. When we talk in the Ayurvedic terminology, we say that Brahmi is a Medhya Rasayana. When we say Brahmi Grita, Grita is the modality, or ghee, is the modality which carries the best principles of the herbs such as Brahmi and helps in absorption of the same. And ghee can really cross the blood-brain barrier, and it is a very good or the most nourishing and good fat which is advised to be consumed. But yes, the way you get the ghee, prepare it, ghee is otherwise also called as clarified butter, is very important. So next, let us move our focus towards yoga. Another extremely crucial aspect or an intervention, which is very much needed for children with ASD. Why? Because it helps in improving sensory integration. It helps in increasing the cognitive ability or motor movements. Social communication and interaction definitely improves with yoga, and it increases attention and memory. And this information which I've just put together is published in the journal Clinical Diagnosis and Research in 2016. So most of them are recent researches, and a lot of research is happening in the field of autism spectrum disorder. And it is important for us to tap that, because research is on paper, it is there, that will not help us. So we have to understand it and start inculcating in the management of ASD, and that is where we are going to really help people who are tackling it. Now, yoga, how should it be? It should be repetitive, structured, continuous, and yoga is non-competitive. There's nothing like speed, etc. And I'm running fast, I'm doing it well. All that mindset is usually not there when you practice yoga. And yoga, as you know, is a science, which is also having all the structured formats of asana, pranayama, relaxation, meditation, chanting. And not only this, yoga starts with yama and niyama, which are your daily disciplines and which are needed for healthy living, be it a child or be it an adult. And yoga definitely provides an environment where the risk-taking ability in a child and self-confidence can increase. And we have definitely seen this with children who regularly practice yoga with us. And overall, when we start training them, initially we train them for about 7 days, then we are watching them once in a week or twice in a week. They connect with us online, or they come to our clinics if they're close by. Then, when we start monitoring them, we start making, also understanding the shift in all these aspects. So here, let me also share some of the studies which say how yoga has really helped children. So in this particular study, 6 children who attended regular elementary classes received about 15 hours of ABA and 15 hours of integrated approach to yoga therapy, which was continuously administered. There were assessments done, and 10-month academic years with 2 months summer gap, of course, wasn't. But what it showed was an increase in orofacial movement imitation. And this happened through Om chanting. So the part of the IAYT, when I say IAYT, it means to say it has all these aspects, from not just pranayama alone or asana alone, but it has asana, pranayama, meditation, chanting, and relaxation administered. And it will be understood and given at the level of the child. This also brought an improvement in communication, language, their play, and improved comprehension of spatial commands, so which is very crucial. So therefore, it's an attempt to make everybody understand that it's just, don't think about herbs, don't think about medication, don't think about only XYZ only, So let your frame of mind be very open, because when modality like yoga is adapted, say, along with Ayurveda, it can really enhance the whole byproduct, which is the end result of maybe making a child speak at 3 months rather than making a child speak at 6 months. So you have to explore this modality. And of course, I understand when the parent is asked to teach the child regularly, they do face issues, because it's not easy to train a child with ASD. But chanting has immensely helped children, and many parents are also teaching them. Usually, a recommendation is they may not be able to chant Om, like we say, chant Om. Definitely is not possible with them, but they can chant syllables very well. So just make them chant then 10 times or 12 times, make them chant oo. Similarly, make them chant This is where, the different parts of the body are also activated. And with chanting, your mind also slightly relaxes. And if the child is able to really like it, because many of the children have great interest in music, so that musical sound attracts them. And mostly, at least till now, I haven't seen any child resisting Om chanting. So this is definitely one methodology which should be given to children. And another study here, we are trying to understand the motor and imitation skills. So ASD children generally have poor gross and fine motor skills, and then poor balance, maybe some kind of incoordination sometimes. So in this particular study, there were 24 children between 5 to 13 years. And, they were put under two groups. One was the yoga group and another was the academic group. And in yoga group, they received 8 weeks of yoga, which was almost continuous, 4 per week sessions. And they did a motor performance test on them. And they found that definitely all these aspects of balance, coordination improved. And as you can see, this is also representing standing, postures, which they did, like the Vrikshasana, sitting, they did a butterfly, frog, and, lying down positions such as bridge. These are, the ways in which we make it interesting for the children. So don't always think, oh, yoga, like the way adults do, my child may not be able to do. So it's definitely not like that. The yoga therapists or the doctors would know how to give it. And see, this is also administered in consensus with another expert who may be telling them to do it. Many times, not every therapist you go to might have the knowledge, but dissemination of knowledge can help them definitely, intervene yoga. Next here, one other study I want to also share is on autonomic dysfunction. When we say autonomic dysfunction, why are we talking about this? Like, we see that there is a lot of arousal, hyperactivity in ASD children. Therefore, we see that the sympathetic system or the nervous system in the in the autonomic nervous system is kind of exaggerated. So the child is usually running around the house all the time, or the child is screaming all the time. The child wants to cry. Anything you do, he doesn't like, he's crying. So many of these tantrums can happen due to an increased sympathetic tone. Yoga definitely has, the ability to bring down the sympathetic tone, and it is understood in different areas, be it hypertension, be it migraine headache, or, be it any other problem. But on ASD children also, one such study was done where they had 50 children, 38 boys and 12 girls. And this was done in a city in India, which is Chennai. And they were allocated based on lottery method. So 25 into yoga group and another 25 into the control group. And yoga group received 40 minutes of yoga for 3 months every day. And they did their ECG recording, which was pre and post, and they found that the sympathetic tone reduced. And this definitely tells us that it reduced their arousal. I also have details of what they administered. They administered asanas such as Trikonasana, Virabhadrasana, Parvatasana, Shashankasana, Tadasana, and calming down postures such as Sukhasana, Shavasana, and Om chanting. So this is a very simple module, and you see how they have bifurcated the duration, 20 minutes of the strengthening asanas, because for coordination, motor processing, it is essential. Calming asanas for 10 minutes and Om chanting for 10 minutes. So an immediate take home, if parents are watching, you can do this, and we can also help you to understand better. And as we now come to the end of, almost to the end of this presentation, it's my pleasure to also be sharing some of our experiences at our clinics. And I will begin that with one of this video, which is shared by a parent. And I thank the parent who has come forward and shared this, because not many parents do this. I really appreciate his effort. So let me play this. You can hear.
Hello, this is Manmohan. I'm a father of autistic kid, and he was diagnosed with autism when he was 3.5-year-old. We started Ayurveda when he was 4.8-year-old, and we found a lot of improvement. And I'm very happy that Ayurveda has shown me the way to heal my son. Lakshya, what's the time?
Time? It's 12 o'clock.
What day is today?
Today is Tuesday.
Very good. Can you tell me 9 ki table?
9 1 cha 9 9 2 cha 18 9 3 cha 27 9 4 cha 36 9 5 cha 45 9 6 cha 54 9 7 cha 15 35 Daddy, 4.
Hello, this is Manmohan.
So what we understand here is, a child like him has probably grown a lot over a period of time. Maybe he is still on treatment, but the formative years were very different, and he has outgrown our expectations as well. So this is, a very crucial understanding for us. So you can see at different levels, the
Hello,
child
Daksha.
has improved.
Hello, Daddy.
How are you?
I'm good.
Okay, introduce yourself.
My name is Laksha. I'm a good boy. I'm 6 years old. I started 1 is 1. Square of 2 is square of 11 is 121. Square of 12 is 44. Water.
Okay.
Did the body and
So basically, the child is able to now answer when his father is also checking. So, many children have improved like this in mathematical, formulas or solving math, improved drawings, art, and many more. So in this particular case, what we saw, and what we see in Laksh now is remarkable. And the child, as I said, has outgrown our own expectation. And he has good eye contact now. His speech is good. His vocabulary is good. He's quite independent. But he may not be, perfectly normal like a 5-year-old child. But he's definitely not, way behind them also. So what is important here is this holistic effort which all of us have put, and commendable effort is definitely put from the parents with all the support, be it doctors, therapists. And as it goes, like when usually a child is on therapy, after a year or so, we see that the parents are able to take those therapies themselves. So definitely that's a good option too. So going
Start.
forward, other case which I would like to share is of another girl who is about 6 years, and she's on say treatment for about a year now, and we have given her basic breathing practices, chanting, and of course Ayurveda, and other tasks are her speech and OT which she is undergoing. So from almost a zero pencil grip, that means she is not even holding a pencil, she writes, she has a cursive handwriting now. From she's always steaming around, but now she doesn't, and with no eye contact, good eye contact now, I would not say it's the best yet, but from syllables she's already talking 1 to 2 lines. She's able to understand a question and answer, but mostly coming from the parents, and reduced attention span to improved attention. So this is actually a good change when it comes to an ASD child, because they definitely take time to respond and progress. And based on my experience, what I have seen is there is a minimum time period needed. Once you start something, don't expect in a month, because you may not see, they'll be still at wherever they were. So average time period of 3 to 6 months is what we have seen some changes. But for good changes, you have to be consistent, and you have to come back for follow-ups. So every month, when people follow up, we are also able to give them the right suggestions, give them the right direction. Otherwise, if you just take something now and go on giving the same medicine and the same yoga for 6 months, your change is definitely going to be less compared to a person or a parent who is trying to follow up with us and trying to adapt. So it's not about following up with us, it's about following up with anybody, being it a speech therapist, being it with a OT person, or an ABA, therapist. So this is how we have to bring in that holistic model in seeing that our child improves. So overall, to just sum up, recommendations from my end will be: diagnose first and do not neglect the signs. As I said, drop off all the egos, whatever emotional blockages you have, and please take your child to the expert. Therefore, an early intervention is extremely crucial, and do not be dependent on standard protocols alone. Adopt and understand how therapies such as Ayurveda and yoga will be highly beneficial for the child. Parent intervention is extremely, extremely crucial in the progress of the child. You have to devote an hour, 2 hours for a child in a day. I understand that all of us are definitely either working mothers or working fathers, but many a times I have seen that many of the mothers have really devoted the time to the child, and that is extremely essential. And overall, when you start putting the child into various activities, don't burden the child. I'm doing OT also, I'm doing speech also, I'm doing this also, that also, this won't help, right? So overall, get the child occupied for say 2+ hours, 3+ hours, depending on the age of the child. Plan it and divide it across the day. Also, take the child out, to a nearby area to play, whether he may not be interested to socially interact, but keep introducing these aspects. A disciplined diet, as we've already discussed, with no junk, no overeating. Don't feed biscuits, don't give them aerated drinks, and mostly give them healthy homemade food, therefore maintaining their gut health. So with this, I also close my presentation and open for a few questions, in case you have questions. Thank you for watching and taking time out to listen.
Right. Thank you, Dr. Vasudha, for that very insightful conversation. I think holistic care, of course, is very, very important, and it was such a hope-inciting presentation that it filled up and warmed like our hearts. To echo Dr. Vasudha's words, anyone has any questions or comments? Right, there's a comment at the chat box. Aryong Choi Hunt K, I apologize if I got your name wrong, saying thanks a lot for the inspiring presentation. Anyone else? Questions or comments? Right. If I may, I have one. Oh, sorry, there's another comment. Same person, Aryong. They have said that this time it was also wonderful to discover about diet. Then Boriana saying that it was an amazing eye opener. Thank you for the comments. Keep them rolling, please. Questions and comments, anyone? You can type out your questions in the Q&A box. Right, there is one from Keshin Kimura. Are there special educational facilities for developmentally disabled children in Indo, which I believe would be Indonesia?
No, must be India because
Oh.
I'm from India, right? So.
Right. My apologies.
No, there are special education facilities, and many of the schools have special education, and they also train. But we also have, those who are trained exclusively, say, to manage children like ASD. So yes, it's available very much in India, and India is actually said to be one of the best places to get such special education. So I also bring that point up.
Right. Thank you so much for that. I hope that answers the question. There's another one from the comments, Sangeeta. She's mentioned, you mentioned Omkara chanting for these kids. Really lots of things I could gather. Thank you. Thank you for the comment. Please keep them rolling. Any other questions or comments? So I have one, and participants, you can also continue to ask. It's not a pit stop if I ask one. But I understand that it's a lot of holistic care, and I heard a lot about trial and error, what kind of food works for people, for the kids and everything. How can the parents support themselves going through this whole situation? As you rightly mentioned, there is stigma and shame and ego involved. So any tips and tricks for emotional support for the parents themselves?
I think yoga is a good solution for them as well, because yoga is not restricted to the child. When it's important, as we know, that if the mental health or the emotional balance of the parent is good, then it will also able them to help their child. So I definitely suggest parents to also take some time out. And the best thing with yoga is you do it and do it with your child. So you're also helping yourself and helping your child. So that way, I think that's the best remedial measure.
Yep, I completely agree. And thanks. There are a few more questions. Aryong Choi Hanke asking, how does the sleep change after yoga? And same person, because many autistic children had difficulties in sleep, parents have to give sleeping pills to the children.
Correct. So this is what I was also trying to tell in the presentation, that don't use drugs because they can be dependent. So I have also definitely seen some of the parents using them, but many of them who have started Ayurveda and yoga have really been benefited. So they have been able to get their child out of this. So initially, when they are, say, dependent on it, as we introduce, say, herbs, like I was explaining, Brahmi or Ashwagandha, the sleep pattern slowly starts improving because their mind starts calming. So what yoga also tells, it's talking about mana prashamanopaya, right? The similar concept is what is adapted, but it's in a combination. When we look at only yoga, even there, when you start giving them some practices such as chanting, practices such as Brahmari, because they can hum. Not necessarily they should say close your ears, close your eyes. They will not close their eyes. So we'll have to just do some modifications, and this will help them sleep. And very simple home remedy, though you may not have access to Ayurveda doctors, is oil application. So take maybe coconut oil, olive oil, or a gingerly oil, which is sesame oil. Warm it up, just apply it on the body, mix it with lavender oil and apply it on the body. It's very, very refreshing because, first of all, lavender oil is very calming in its nature. So you can start adapting such tips also. but never get vulnerable to sleeping pills, because one, when you give them one, okay, they might sleep, but you're also bringing down their measurable capacities, because when you give them this, the next day they may be very drowsy, so they are not in any a state that they are able to perceive whatever you're going to give them in training, so it won't help you.
Yeah, it sounds like a real trouble to give children sleeping pills because they won't be ready for the next day. And Ayurveda is one of the effective solutions, hopefully, which will work. And amazing tips and tricks again. And of course, it's always very welcomed. There are a few more comments coming in. One from Boriana. She mentioned, perhaps you can come to Australia to share your knowledge, as yoga is not used for treatment of autistic children in Australia. That's something for you to consider, Doctor. There's another one from June, and she has said, thank you so much for the wonderful presentation, Dr. Vasudha. I learned a lot about their symptoms as well as how we may be able to help them as therapists. The improvement, as we could see in the case study, was truly amazing. And Aryong also said thanks. So great comments. Keep them rolling, you everyone. There are also some questions coming up. What techniques do you use in yoga therapy for children with developmental disabilities?
So today, with specific reference to autism spectrum disorder, we of course have made a small module which we try and follow, but we definitely make modifications in the same. So here, what we usually use is a set of breathing practices, and maybe a set of postures which are animal based, like, or nature based, like we say vrukshasana, a tree pose, or a cat pose, a tiger pose. This makes it interesting for the children. And with that, we try to introduce breathing with them with parental support, because the parent has to be there, otherwise the child will run away. The behavior of an ASD child. And along with that, practices where they have to close their eyes and do something is definitely not possible. Next is chanting. So we try and make a mix of such postures with breathing practices and chanting, and slowly start introducing deep breathing with pranayama. And usually we are effectively able to deliver Brahmari, because they're able to do. When it comes to pranayama such as Nadi Shuddhi, it is difficult. But yeah, as and when we continue, we are able to achieve that as well.
Yeah, never underestimate children's learning capabilities. Right. Savita has two questions. One is there an age limit to starting on the treatment? If the child is older than 5, does the treatment work? And the second question is how to improve attention.
So the first question, you can start treatment as soon as you know or understand that the child is detected ASD, because it will usually be beyond 12 months. So that is the average. Very rarely, we have come across parents who say, I got it diagnosed at 8 months, 10 months, because it's difficult also to diagnose at that particular age. So we can start treatment anytime, but for a 1-year-old, 2-year-old, yoga may not be greatly, we cannot intervene greatly with yoga unless they are 3+ or 4+. But when it comes to Ayurveda, yes, we do intervene for a child as young as 1-year-old also. And I think the next question, Surabhi, was on attention, I suppose.
That's right. Yeah.
So as and when we do yoga is effectively anyway known to influence attention, concentration, all our cognitive functions. And therefore, as and when we continue breathing practices and pranayama, we overall start seeing definite attention improvement. We also give them some attention enhancing practices, where they're also treated with something when they do a particular practice. Parents are also asked to bring in these modalities, such as, a simple example would be, you have a chair in a room, So now the child has to sit there, for half a minute. He's never even sat for half a minute, say. Then from there, we slowly move on to 1 minute. And whenever he does that, he will get a small treat with whatever he likes. So this introduction also helps the children. But it finally, it's also dependent on the level of autism. So that's also crucial. That's why, it's not like one for all here. So it has to be very, very designated and customized for everyone. And whenever we train ASD children, we do not do it in groups. We always do it individually, yoga therapy, one-on-one sessions.
Yeah, I think again, very insightful answers. Thank you so much. There's another one by Satyendra Sharma, and he's asking whether it takes some time before Ayurvedic medicine shows effect.
Yeah, definitely. So as I said, an average duration we have noted is anywhere between 3 to 6 months to see some good minimum visible changes. And as and when we progress, these changes do improve. In a month, we definitely are able to tackle digestive problems. But when you look at over cognitive functions or hyperactivity, there it is difficult to find some changes.
Great, thank you for that as well. We have another one by Bubbly Sahu, and they're asking how to decide which diet suits our child.
So it's more on the trial and error initially. So if, like we said, GFCF, you can give them gluten, you can give them wheat-based products, preferably made at home. You can give them some buttermilk or yogurt, of course, not usually recommended from the market. So if the child is not reactive and the next day or the next few days his gut has been okay, then you can always continue. But if we know that science is also showing go less in gluten, instead of completely avoiding it, we can go less. We can introduce different elements. We can use millets. We can use rice-based preparations, and definitely give a healthy diet which is needed for the development of the musculoskeletal system also in the child. So this analysis has to happen in consultation with the doctors also, because they will also be able to help you understand what's right, what's wrong, what's intermediate.
Right. Yeah, trial and error. It can be quite tiring. Thank you for that as well. We have another one, and some of these questions are coming from Facebook with our live watchers. Thank you for the questions, everyone. This question is whether Ayurvedic medicine causes some adverse symptoms in early period of use, say first month or so. This is by Satyendra Sharma. Yeah.
Okay. So, many a times it's not about adverse effect of the medicine or the herb which is used. Sometimes some of the children do, react in a way that maybe, they are a little intolerant to the medication used or the dosage. At times we see slight hyperactivity increasing, in some kids. But once they come back to us, then we are able to rectify and then, put them on the right dosage. Therefore, usually whenever I give this prescription of Ayurveda very first time, I definitely put this in their mind and put a statement saying, in case you find any issues, please connect back. And once they settle down, which is between 15 days to 21 days, then mostly we don't acquaint problems.
Thank you so much. There are a few more. Keep them coming. There's another one by Hari Chandana Goti Mukhala. How long do we need to continue Ayurvedic treatment in autistic children? How many years?
That cannot be mentioned right away because it depends on how the child is going to respond. But I think you should be ready to give the child some medicines. I mean, when I say medicines, they're mostly supplements. Like I'm talking about a nootropic herb for at least over a period of 1 to 2 years minimum. But since autism cannot be completely reversible, a small set of medications or supplements definitely can be continued. And when we, as the age, get them more so tuned with yoga, because that is something which can help them across their life. And this is a very humble request to all the parents, that please don't keep relying just on medication alone. Work very well with yoga, because it can really help.
Right. There are a few more, and thank you for that. There are a few more from our Zoom watchers. Kishin Kimura is asking, in India, what kind of jobs do children with developmental disabilities have after they become adults?
Yeah, I think it's a good question, because we should know what's the future, in place for such a child. So many of them are, depending on how they recover from ASD, of course, can get into jobs based on their education. And otherwise, there are, say, we are also connected with another organization where they do block printing, they do hand printing, they do a lot of natural dye based solutions, treatment. So that, because autistic children are very creative people, so many a times they go into such industries where there is a lot of creative skill needed. And in India, you don't have a dearth for this, because I think you have a lot of industries here who work on this aspect.
Right. It's a little unfortunate, but it is the reality. There is one more question related to attention span. How long does one session take for younger children under 10 years old? The video was a little longer than 1 hour.
Right. So it takes about, usually when we teach for about half an hour. And that's the recommended time duration, because you can hold on to the attention of the child around that time. And as and when they get used to, you can make it 35-40 minutes. But for young children less than 10, it is difficult to get them doing for an hour. If the child is mildly autistic, as and when they practice yoga initially for themselves, slowly they can be put into group classes. But yes, the teacher should know and have an understanding about the problem. And there, when they start doing it in a group, they will start slowly getting, they get adjusted to that 1 hour practice.
Right. Thank you. There is another one from Sindhu. They're asking, they have a comment. They're sharing, hello, ma'am. My son was in mild category ASD. Then with early intervention and therapies along with Ayurvedic treatment, he has improved a lot. He's 15 years old now, no issues with food, sleep, routines. He's a good dancer, plays basketball, quite fit and healthy lifestyle, does all exercises perfectly. Overall, more like normal. His only issue now is he's not able to initiate conversation and continue the conversation. He will answer if we ask questions or anything he needs. Can Ayurveda help with this?
Ayurveda medications can help, but what is important is his confidence building. So I also shared a study with you. So I think his yogic routine has to be a little more disciplined, and yoga can give him that confidence, which is attained by the practices. Because when, say, now if we deal with a patient of, say, depression, what is also wrong there is they need that confidence to come back, and yoga can instill that. It can change the neurotransmitter levels, and like we spoke, in terms of physiology. So therefore, continuation of Ayurveda medication, which are also going to enhance his confidence, along with yoga intervention, I feel would definitely be beneficial. But it should be a very regimental yoga intervention, where the therapist is able to understand the requirement of the boy and then teach.
Right. So a lot of communication and a lot of routines and regiments. Yeah. Thank you for that. So far, that's all we have. You can continue to the participants. You can continue typing your questions in, and should we have the ability or the time, we will be responding to them. All right. Thank you, Doctor. Any other comments or anything else you would want to add? Right. I think all participants have had their voices heard, which is excellent. Thank you for the questions and the comments. And oh, there is one more question by Savita. We have literally 1 minute. So yes, go ahead, Savita, just type them out. Sorry, give her a minute, yeah.
I think it was overall, a series of questions also opens up a lot of curiosity in others who may want to ask, but who really don't know exactly what to understand from. So I think these questions will also help share insights in a better way.
Yeah, definitely. It kind of helps us know what parents are looking for as well. So Savita has asked, can you give any common yoga postures to follow?
Yeah, I mean, for children, you can definitely give concentration building practices such as Vrukshasana. You can use Garudasana. Then you can start giving them poses such as tiger or cat camel pose. And of course, give digestive enhancing practices such as Pavan Muktasana, Setu Bandhasana. And after these, give them adequate relaxation in terms of giving them instructions, because otherwise they lose attention very quickly. A simple relaxation for them good would be IRT. And then you can practice pranayama or breathing such as hands in and out breathing, hand stretch, ankle stretch, and of course in lying down, straight leg raising, and then in prone you can do shalabhasana breathing. And after that, once again, quick deep breathing in supine position to relax. And then you can give them pranayama practices and chanting. This can be a very small module between 20 to 25 minutes or 30 minutes maximum.
Right, thank you so much. And that is 8:31 on the mark. Thank you again for the very, very insightful conversation. It was thoroughly enjoyable and very informative. I wish you all a happy rest of your day, yeah?
Thank you, Surabhi. Thank you.